Hello and welcome back to DrDoctor. Today we talk about influenza. Influenza, commonly known as flu, is a contagious viral illness that affects our respiratory tract. It can cause anything from mild illness, which resolves on its own within a week, to severe illness and death. Approximately 1 billion people are affected worldwide each year, and around 500,000 people die of this illness annually. Young children, the elderly, and those with impaired immune systems unfortunately suffer the worst. Furthermore, influenza can cause global pandemics. In 1918, the H1N1 virus caused a global death toll of up to 100 million people, and this spread worldwide from remote Pacific islands to the Arctic Circle. Flu is caused by the influenza virus. There are 4 main types, A, B, C and D, and only influenza A and B cause clinically important human disease and seasonal epidemics. Within each type, there are many different subtypes based on the antigens on the viral envelope. Thus, flu is not simply caused by one virus, but a whole host of differing viral entities. Flu spreads mainly from person to person via the tiny droplets produced when we cough, sneeze or even talk. It is said to be contagious from around a day before symptoms develop to around a week after you first become unwell. So what are the symptoms of flu? It is defined as sudden onset of fever, myalgia, which is muscle aches and pains, fatigue and tiredness, dry cough, sore throat and nasal congestion. It is also common to suffer with gastrointestinal symptoms such as nausea, vomiting and diarrhea. The incubation period, which is the time from infection to development of symptoms, is between 1 and 4 days. So how is flu diagnosed? Usually, diagnosis is made based on clinical symptoms when the virus is known to be circulating in the population. If a patient is admitted to hospital, however, the diagnosis can be confirmed by nasal swabs or other samples from the respiratory tract being sent to the lab. So, is treatment needed? In healthy individuals, the illness is usually self-limiting, and thus the mainstay of treatment is supportive measures. Rest, adequate fluid intake, and staying off school or work until 24 hours after its resolution, and this is to limit the spread. Antiviral treatment is usually reserved for those at risk of complicated influenza, and this includes the elderly, those with chronic medical conditions such as lung disease, those with impaired immunity, and pregnant women. Antivirals have only been shown to reduce duration of symptoms in healthy individuals by less than a day, but there is some data that they can reduce adverse outcomes in the high-risk groups. In high-risk groups, flu can lead to complications such as pneumonia, bronchitis, and sinus and inner ear infections, and it also worsens any underlying disease such as asthma or heart failure, and it is in these ways in which individuals can become unwell and potentially die. It is thus incredibly important for us to try and prevent the spread of the disease, and this is by vaccination. As the virus commonly changes between seasons, vaccination is updated annually to attempt to target the likely viral strains that will circulate that winter. In the UK, annual vaccinations are offered to the high-risk groups discussed previously, as well as with healthcare workers, those that live with high-risk individuals, and also children aged between 2 and 17. So what is the reason that seasonal epidemics occur? The viral proteins commonly change between influenza seasons, and this is known as antigenic drift, and these usually peak in winter times in temperate regions. Pandemics, which are global epidemics, can occur when a new influenza A subtype occurs through a sudden protein change known as antigenic shift, and this is usually due to the virus combining with those that usually circulate in certain animal groups. Recent concerns have mainly been regarding avian influenza and also swine influenza. In summary, influenza is common and usually a self-limiting disease in its nature. However, seasonal winter epidemics often cost the lives of many of the elderly and unwell citizens. National annual vaccination programs are thus crucial in limiting these numbers. There is always the worry of a global pandemic, the last significant one being a century ago. Thank you for watching. Please subscribe if you enjoyed this content, and do check out the other videos in this series, which focus on some of the deadliest diseases and the ways in which we can combat them. Feedback is always appreciated, and please stay tuned for the next episode.